We know one thing contributing to some of the outbreaks: workers going from job to job at multiple nursing homes. It's actually a common practice for several different reasons. Our Susanna Black is digging into that part of the story tonight.
If you don't have the patience and the compassion, that job is not for you because it is very difficult.
Teresa Moore has worked in long-term care since 1993 and says the already thankless job is now much worse because of coronavirus.
Probably having to work longer hours and with more patients, and yeah, I wouldn't want to be in their situation right now.
A situation she says was already bad enough.
You don't make no more than $22,000, $25,000 a year. You're understaffed, undersupplied sometimes with the supplies you need, and it's a lot of headache.
Moore ended up leaving care facilities entirely, moving to private in-home care to be able to make a living. But she says many don't get that chance. Instead, they have to add to their workload, taking on jobs in multiple care facilities just to make ends meet.
There would be a lady on 3rd with me. She would leave work in the mornings on 3rd, and she would go to another facility and work a first shift job.
A sad reality that's now having tragic consequences across the country. In Washington state, a CDC investigation into a nursing home linked to 37 coronavirus deaths found the sole cause behind the outbreak were workers going to jobs at multiple nursing homes carrying the virus with them.
The report will say that there were problems with nurses coming in. We've discussed this, nurses coming in and going to other facilities. Prior to this event, there had been no guidance from any agency telling us that that practice should be stopped.
That is a very common practice in our state for staff to work at 2 to 3 different long-term care facilities.
Lauren Zingroff is the executive director of Friends of Residents in Long-Term Care, a nonprofit that advocates for nursing home residents and their families. She says staff bouncing between multiple facilities won't stop anytime soon because no one's working to change the conditions forcing them to be there in the first place.
We do not currently have a living wage here in North Carolina, and they don't have health insurance either. I mean, it's not a choice. I don't think many of us would say we want to work 2 or 3 different jobs just to get by, but that is what they're having to do.
So with nowhere else to go, employees are going to work, continuing to fall ill and creating even deeper staff shortages.
We are seeing staff that are sick and cannot come. We are seeing staff that are not going to work out of fear because there is an outbreak at their facility. And then what's going to happen then in regards to making sure that we have the right amount of staff and an adequate number to take care of all of the residents.
As for Teresa, she says, unfortunately, based on everything she's seen over the years, we will likely continue to see outbreaks in our nursing homes.
Because if you have patients that have tested positive and you're working around them on a daily basis and you're leaving there, going to another facility, then you're not going to contain it. It's just going to keep spreading.
Susanna Black, Channel 9 Eyewitness News.